Hello, family. Let me share on the main page. You know how we do. So let's see. Get ourselves shared. How have you been? It's been 2 weeks since we've seen each other. Good to see you guys. Let me share this real quick. Make sure I'm spelling everything right. Got it. Starting now. All right. There we go. My phone is glitching. Hello, hello. Good evening, everyone. Get my little eyes together. It's been a long day of screen time, so if I'm a little squinty, you'll know why. Still celebrating, even though I know it's no longer Leo season. I'm still representing, just because that's what Leos do. We extend our season, right? All right, so it's been a while since we've seen each other. I'm excited to be with you guys. A year older. Good evening, good evening. Thank you guys so much for all the birthday love, text messages, posts on social media, even surprise packages. I will be posting it later, but I have to shout out my sister, Miss Charisse Worthy, for sending me a gift box with my name on it and all kinds of lavender deliciousness inside of it. So publicly, thank you, my love. I appreciate you loving on me. So I'm going to jump right in because there's a lot to cover and I want to make sure that I cover everything, all right? So you guys know how we start this out. We start with our numbers, looking globally and then within the United States. And then we talk about what our metrics, right? Our daily case rates, our percent positive, where we are in terms of our trends. And then we jump into what I call some hot topics, all right? So let us begin. Oh, it's just so sweet. All right, from a global standpoint, we are now at a little over 214 million individuals who have acquired COVID-19. Of those 214.6 million individuals, we are now at 4.475 million people around the globe who have lost their lives to COVID-19. Here in the United States, our numbers continue to increase substantially. We are now a little over 39 million individuals who have acquired COVID-19 over this now 19-month period of time. In terms of the number of people who have died, we are now at a little over 649.5 million individuals who have lost their lives to COVID. The average daily new cases, looking across the country, it looks like the country is on fire. It's very reminiscent of what we saw in January when we look at the maps of a metric. You guys know that the goal is less than 25 new cases per 100,000. That takes us out of the red zone and puts us at least in the orange zone. However, there are now 42 states and U.S. territories. I have to make sure I'm clear on that, because you'll hear the next number I give you and you're like, wait, that's more than 50. But 42 states and U.S. territories that are in the red zone, right? And when we saw each other just 2 weeks ago, there were only 21 states in the red zone. We are now at 42 states in the red zone, meaning that there are more than 25 new cases per 100,000 residents in each of those states. In terms of the top states, Mississippi is leading the country in terms of daily new cases per 100,000 residents. They are at 117.5 new cases for every 100,000. Louisiana is not too far behind Mississippi at 100 new cases per 100,000. And then you see Florida, Tennessee, and Kentucky rounding out the top 5 in terms of the highest number of new cases across the country. In the orange zone, we have 12 states in the orange zone. I'm proud to say that the state of Maryland has maintained in the orange zone. What we're seeing is within the New England and in the northeastern part of the United States, Jersey, New York, all the way down here in the mid-Atlantic, DC, Virginia, and Maryland are maintaining in the orange zone. Not a single state is in the yellow zone with 1 to 9 cases, and not a single state is in the green zone with less than 1 case per 100,000 residents. So there you go in terms of what the outlook is. If you are traveling at all, pay attention to the daily average number of new cases. I'm not telling you not to travel. I just got back from Virginia, but that's really that's still DMV, right? I'm not leaving out of my bubble, my DMV bubble, until this stuff settles down. That does not mean I'm judging anybody who has decided to travel. It just means to travel safely. Make sure that you're vaccinated if you're comfortable with it. Even if you are vaccinated, you need to mask up. And we'll talk when we talk about giving some updates on transmission. Why even in a crowded outdoor environment. I was just at Wolf Trap enjoying Trombone Shorty last night. And we were well distanced up on the top of the hill, but in close proximity to people as we were coming in to the Wolf Trap venue. We had our masks on. I opted for lawn seating, and my mommy and my friend mommy, our best friend mommy, they made sure that we were situated in a space where we would have at least 6 feet of distancing apart, and we were not crowded. But there's now a recommendation in crowded outdoor venues that we should still wear our mask, vaccinated or not. All right. I couldn't pass up Trombone Shorty. I had to go see my boy. But that's where we are in terms of our daily average number of new cases. The entire country it looks like the entire country except for the Northeast and the New England states. It looks like the entire country is literally on fire with the redness, the penetration of COVID-19, the Delta variant. It's amazing. It's all red and it's the Delta variant. Go figure. All right. So percent positives, we usually use this as a metric. This is why I'm going to tell you I'm sort of iffy as to whether or not we continue to do it. One, only 37, there's a handful of states who are not reporting out on a regular basis their percent positive. Those states include Alabama, Florida, Puerto Rico, and South Dakota. Haven't reported out. Alabama hasn't reported out their percent positives in the past 3 weeks. A lot of states are so busy dealing with active COVID cases that their data collection, they're just like, whatever, it doesn't even matter what our percent positive is. It's high, is pretty much what they're saying. And so when we look at the map across the country, there are 37 states with percent positive tests greater than 5%. But the question is, how accurate, as you guys have brought up before, how accurate is percent positive, especially when 2 things are happening. One, as I just mentioned, states aren't all collectively reporting out. There's not a mandate. And 2, particularly with vaccinated individuals, they're not necessarily going in to get tested, especially if they know that they're vaccinated and are only having mild symptoms. They're not necessarily presenting for testing, and that's what the data is demonstrating across the country, is that those who are vaccinated who may suspect that they have COVID-19 aren't necessarily going in to get tested. They assume that they have it, and they're doing what they need to do to protect others. In terms of who's leading in percent positive, you can imagine Mississippi leads the country in terms of percent positive. The second state that leads is Kansas, right? And the question is, for the other states that I mentioned that are having these ridiculously high daily case averages, Louisiana, Tennessee, and Kentucky, they're looking at like single digit in the 9s and in the 8s in terms of percent positive. And is that truly reflective of where they are? Or is it a lack of reporting or a lack of testing with an assumption that people have COVID without necessarily doing confirmatory testing? So all of those are reasons why the percent positive metric is something we may have to revisit. In terms of our trends, testing did increase over the past week. by about 23%. So that is good news. But as we've talked about before, recently it's become much more difficult to be able to get on the spot testing depending on where you live. As I mentioned before, it took my mom around 3 days to be able to find a site for a COVID-19 test after she returned from travel, just in doing routine COVID-19 screening after potential exposure. So the more difficult you make it for someone to get tested, the less the likelihood is for someone to pursue it and just to either assume that they're fine or to assume that they have it and then they quarantine. The other variable is at-home testing. Yay! You can now, at your local pharmacy, get antigen testing right in your pharmacy. And so part of the data reporting out is also impacted because individuals aren't necessarily compelled to report out their positive testing if they are doing it at home. So that's also affecting our ability to appropriately assess what is the true percent positive across the country. In terms of new cases, we continue to see exponential increase as it relates to the number of people infected with COVID-19. Today, we reached a peak of 151,000 new cases, an increase of 23% compared to the day before. So the rate of rise is starting to decrease, right? So when we last saw each other about 2 weeks ago, we were up to around 98,000 individuals per day who were acquiring COVID-19. Now, 2 weeks later, we are up to 151,000 individuals who are acquiring COVID-19 every single day. But compared to yesterday, we're only up by 23% as opposed to 2 weeks ago where we saw an increase of around 112%. So when we look at across the country in the states that were most heavily impacted, states like Louisiana, states in the Midwest, we're starting to see a flattening in terms of the rate of rise of cases. But what you guys likely remember from our previous conversations is that deaths and hospitalizations usually trail by 2 to 3 weeks, which is why we are seeing record-breaking numbers of hospitalizations in states like Louisiana. So those peak cases that happened 2 weeks ago, we're just now seeing the impact of those cases now here in places like Louisiana. So as you can imagine from what we just talked about, much of the South across the Bible Belt, right, is dealing with their most serious outbreak since January. In some states like Florida, they are exceeding the number of infections that they had in comparison to what was going on in January. So clearly there is work to be done in the South, but as I mentioned before, in the Midwest, places like Missouri, in certain states within the South, Arkansas, and starting to see it in Louisiana, we're starting to see a plateauing of the number of new cases. But what we are also seeing simultaneously is a spike in terms of hospitalizations and deaths related to COVID-19. The Northwest is starting to pick up in terms of their new cases, both in Oregon and in Washington State. They have increased their new cases by 100% over the past 2 weeks. So by the time we see each other again this time next week, I can imagine that Oregon and Washington are likely going to move up in terms of those daily average number of new cases. Those are two states that we definitely want to keep an eye on. In terms of deaths, we are now averaging a little over 1,000 deaths per day, significantly lower than we were when we were at our peak of the pandemic back in January. But we continue to see an increase. When we last saw each other, there was an increase in the rates of death by about 49%. We were averaging 2 weeks ago a little over 600 people dying per day. We have now almost doubled that in a 2-week period of time. And the majority of those individuals who are dying from COVID-19, as we've talked about before, are individuals who are not vaccinated. And so that's something that we have to keep in mind. And as we talk about, when we see these spikes in cases across the country and in these individual states, in 2 to 3 weeks, we're going to see spikes in deaths and hospitalizations. My little brother just sent me a text yesterday with a news article showing that Louisiana had record-breaking deaths just yesterday. They broke their record within the entire 19 months of the pandemic just yesterday, because the sheer number of people who acquired COVID-19 facilitates a significant increase in the likelihood of death, especially when Louisiana is in the lowest 5 states in terms of vaccination rates. It unfortunately makes sense. The lower the vaccination rate, the higher the rates of COVID-19, the higher the rates of COVID-19, the higher the rates of hospitalization and death. That's just based on what the numbers say. It's not meant to scare anyone into getting the shot. That's just basic statistics based on what this virus has demonstrated in terms of risk of hospitalization and in terms of risk of death. In terms of transmission, and before I go into transmission, I want to make sure I don't miss anything. Let's see. What is the difference with schools? Oh, we'll definitely talk about schools and how they're being impacted as it relates to COVID, especially as children are going back into school. You know that I have a completely separate section for the babies. I'm dedicating from this Facebook Live on until we're out of this pandemic in a concentrated way. I will be specifically talking about children and how we're navigating this through this pandemic, especially as we're getting ready to send our babies back to school. All right, my love. So let's talk transmission. In terms of new guidelines, we talked about those before. The CDC just put out a recommendation that if you are outdoors but in a crowded environment, if you're going to a summer concert at Wolf Trap to catch Rebirth Band and Trombone Shorty, if you're in a crowded environment, if we had opted for the pavilion seats and not the lawn seats, then we would have all been masked up. So if you are in an outdoor crowded environment, vaccinated or not, you need to wear your mask. If you are indoors, vaccinated or not, you need to wear your mask. I don't care what some random person on TikTok tells you, even if they have an MD, an MPH, a PhD behind their name, and they're telling you in their little video that masks kill your brain cells, masks trap carbon dioxide, masks disallow oxygen exchange, masks don't work to protect you from COVID. All of those things are mistruths, right? As a physician who wears a mask almost all day, every day, clearly I can still conjugate verbs and use like 3-syllable words. It has not affected my skill sets, my expertise, my insights, my knowledge at all. A lot of us sent our children back to school last school year where they wore masks the majority of their days. Surgeons wear masks. Oh my goodness, I scrubbed in on surgeries, as you guys have likely heard me talk about. The longest surgery I think I scrubbed in on was like a 12-hour surgery for a tiny neonate. And I was perfectly fine with asthma, active asthma, like the asthma that when triggered takes me to the ER kind of asthma. So don't let anyone trick you into telling you. Don't let Busta Rhymes, all right? Don't let Busta Rhymes tell you you don't need to wear a mask. Let him not wear a mask and deal with his health consequences. You guys wear a mask because Dr. Yola told you to, all right? From a trusted source. But now the CDC is telling folks, wear a mask if you're outdoors in a crowded environment. And this is based on looking at crowded environments, that motorcycle rally, Lollapalooza, a couple of other events across the country that have facilitated an increased risk of COVID-19 transmission, even though they are outdoors. As we've talked about before, the best protection against COVID-19 is an N95. This is the one that I bought for little mommy. As I spoke about before, there are N95 masks for little ones. This mask is smaller than your standard adult size mask. This actually fits me fairly well, but it's for little mommy. This decreases the risk of transmission of COVID-19 by 83%. So imagine your vaccine protecting you, and then you throw in this mask on when you are indoors, or sending your little ones to school with this mask on, all right? So that reduces it by 83%. If you do a double layer cloth mask, and it's fitting well, right? That's the important part of it, is that it fits well. You can reduce COVID-19 risk by 65%. Best choice is an N95, but if you can't get your hands on one, your little one is like, this mask is too tight, I can't breathe through it, whatever the case may be, or they're like, it's ugly and I don't want to wear this ugly black mask, I want my astronaut mask, make sure it's double layer fabric and that it fits well. so that we are protected. As you guys can imagine, as we continue to see numbers rise, the majority of individuals in the hospital, and I'll say this over and over again, the majority of individuals in the hospital dealing with battling COVID-19 are those who are unvaccinated. There was a recent study that the CDC released looking at data coming out of California, where those who were not vaccinated were 5 times more likely to end up being infected as a result of exposure from COVID-19, and over 29, almost 30 times more likely to end up in the hospital. Right? And while we are battling overcrowding of hospitals, closures of hospitals due to lack of either beds or staffing, right? There may be plenty of beds, but not enough ICU nurses, not enough ICU doctors to be able to manage the patients that are in there. You want to take that into consideration, especially now, as we'll talk about in a little bit, the FDA has provided full approval of at least the Pfizer vaccine. So take that into consideration. The risk is real. It isn't that doctors are inflating numbers or we're withholding treatment to prove a point. Like, that goes against our Hippocratic oath. I'm not going to tell you that there isn't a bad apple in the bunch. Clearly there is with any profession, but 99.9% of us who are working in hospitals, working in health systems, are there to save lives, not to cost people their lives, simply to push people towards getting vaccinated. It's just the basic numbers. We knew this from the data coming out of the clinical trials. Now we know this information in terms of risk of hospitalization and death in unvaccinated populations, simply because of what we're seeing now, especially with this Delta variant. Now, let's talk about breakthrough cases, because I know some of you or your friends or your family members are like, what does it matter really? Because even if you're vaccinated, you're still getting the cootie. I'm not going to disagree. Is there a risk, as we've talked about before, of acquiring COVID-19 even in the face of vaccination? Absolutely, yes, there is. Because, as we've talked about over and over again, the goal of our vaccines were to decrease the risk of severe infection and to decrease the risk of death, right? The bonus is to decrease the risk of infection once exposed. That is what we're hoping for, but what we are guaranteed is a decreased risk of severe illness and death from COVID-19. Now, because the Delta variant has shown up and shown out, simultaneously with data being gathered to show us that after 6 months, not at 6 months, but after 6 months, right around a 7-month period, data has now come out just over the past 2 weeks. This is the reason for the booster, that the immune response starts to dip significantly after that 7th month. So you combine a more potent variant, right, with more infectious particles, with a start of a decline in immune response, put those together, and you put those who are vaccinated at increased risk, which is why there is a recommendation for a booster, which we'll talk about in a little bit more detail. But just so that you know, 99.9% of those of us who are protected, who are vaccinated against COVID-19, we are 99.99% less likely to show up in hospitals with COVID-19. And I know you're going to show me states like in Oregon, where the majority of the folks who are acquiring COVID-19 are those who are vaccinated. But you have to think about this also. There's within these states where a significant number of the individuals are vaccinated with a heightened amount of virus and declining immunity, you are going to see these numbers start to increase until we get into the throes of getting people their booster vaccine so that we bump that immune response back up. That's where we are now. The CDC, I want to make sure I get the number right. The CDC has now reported out that there have been a little over 8,000 significant breakthrough infections across the country. Mind you, the CDC is not collecting data on mild breakthrough infections. So the denominator is likely larger, especially in the midst of this Delta variant, just giving the country a nice spanking. But when it comes to significant illness resulting in hospitalization and or death, only a little over 8,000 individuals over the time that vaccines have been available. A little over 8,000 individuals have acquired COVID-19, been hospitalized, or lost their lives to COVID-19. You compare that to the hundreds of thousands of individuals who have been unvaccinated adding to the numbers of individuals in the hospital and dying from COVID, the numbers just don't compare in terms of how well this vaccine is serving us well. All right. So I want to make sure that you guys fully understand where we are. So right now, I believe we're now at around 200 million people who have received at least one dose of the COVID-19 vaccine, right? So when you think about it, less than 10,000 individuals, right? 8,000, maybe it's like 8,157 people have either been hospitalized or died from COVID, even in the face of a vaccination. Now, the media is going to push the stories out. It'll be that one person that they report on. She was vaccinated and she still died. Compared to the thousands of people who are now, 1,000 people plus are losing their lives, with 99% of those individuals being those who are unvaccinated. So keep that in mind when you hear those news reports, because it's going to sound scary depending on which news station you watch, right? If you spend a lot of your time watching Fox, you will walk away thinking that people who are getting vaccinated are dying at the same rates as those who are unvaccinated, and that is absolutely not the case. The majority, not over 95% of individuals who are losing their lives to COVID-19 are in the unvaccinated population. So I want to make sure we are clear on that, all right? In terms of variants, there isn't really a lot of information to update you on, other than the fact that the Delta variant is still showing up and showing out. As you guys know, it is the predominant variant here in the country. It's responsible for almost 100% of all new COVID-19 related cases. They're anticipating that the peak will hit towards the middle of September. We're starting to see it, as I talked about before, in a couple of states like Missouri, Louisiana, and Arkansas. But when we look at the UK and Israel, we still see the Delta variant wreaking havoc in both of those countries. We're looking at them to see what direction will we take as we continue to move through the fourth wave of this pandemic. But it's not anticipated that we will be out of it until likely the middle of September. And so there's still a lot of work to be done. But the most important thing is for us to get ahead of it so that there isn't a new, bigger, badder version of COVID other than the Delta variant. My prayer, my wish, my hope is that this is the worst case of COVID that we deal with. But it's really up to not only us here in this country, but how we engage globally in terms of protecting each of us from COVID so that we do not manifest yet another dangerous mutant. In terms of treatment, I want to talk a little bit about these Llama antibodies, right? I was asked to talk about it on BNC and on Dr. Wilmer Leon's Critical Hour. What we learned from this study coming out of Belgium is that Llama antibodies, I'm like, wait, where did they get that? How did that come about? Like, who decided, let's see what the llamas are doing? But the interesting thing is, Llama antibodies were actually used for MERS and for SARS back in 2016. Apparently, there is a group in Europe that has been looking at and focusing on Llama antibodies for a long time. Who knew, right? But particularly with this with COVID-19, this group in Belgium started to examine the role of Llama antibodies with COVID-19, given how well they did with MERS and SARS, which are also coronaviruses, back in 2016. And the beauty of the Llama antibodies are that they're super, super tiny, much smaller than our antibodies. And so they can fit in places on the spike protein that our antibodies cannot reach. Right? And the places where these antibodies, these wonderful Llama antibodies are connecting are in places where they're not yet mutations. Woo! So that means that the Llama antibodies are not only able to get into some grooves, but evidence shows that they are more effective at neutralizing COVID-19 than even our own antibodies. So they're calling this a potential game changer in terms of how we are treating patients with COVID-19. Now, I know for some of you or some of your families, you're like, oh, then I don't need to get the vaccine. No, pump your brakes. You still need to get vaccinated, right? This is a supplement to the COVID-19 vaccine. So if you develop symptoms, especially if you are at a high risk, so are immunocompromised, are seniors, anyone with significant chronic diseases, obesity, high blood pressure, heart disease, all of those are going to be indicators for potential Llama antibody treatment. Also for individuals who are hospitalized and battling COVID-19, Llama antibodies may be a treatment of choice. Now, I'm sure you're all asking, well, how do we get some of these Llama antibodies? Dr. Yola does not yet have the answer to that question because all of this research is being done in Belgium. But I can almost guarantee you, given the success of, at least in clinical trials, and historical context with MERS and SARS, given the success of the Llama antibodies, I can imagine that we're going to be able to find Llama antibodies at some health system near you. But because this is preliminary data coming out, we will see how this manifests in terms of treatment modalities here in the United States. And I can't help but think about the stories, don't touch the llama. In this case, we sort of do get to touch the llama because llamas are actually showing to serve us well in battling COVID-19. So yay, Llama antibodies. I want to make sure I don't miss anything before I move on. Good evening, good evening. So we talked about Llama antibodies. I will definitely keep you guys posted as we progress with figuring out when do we get access to Llama antibodies here in the United States. Let's talk about vaccines, all right? We are now at over 200 million individuals here in the country who have gotten at least a single dose of COVID-19 vaccine. 61% of us have received at least one shot. That means 73% of those 18 and older, 71% of those 12 and older, yay, and over 95% of those 65 and older. So shout out to our seniors for holding it down for the rest of us, right? Nearly 172 million individuals here in the country are fully vaccinated. We are still just above 50%. Only 52% of those who are eligible at some point in time that can get the vaccine are fully vaccinated. 12 and older, we're at 61%. 18 and older, we're at 63%. So clearly still work to be done. And as we've talked about before, because of how much more infectious the Delta variant is, researchers are estimating that we will have to reach 90% herd immunity in order for us to get over this hump. They're anticipating that that's not going to happen for another 7 to 8 months. So we're not going to reach it until around 7 to 8 months from now, sometime in March. But the game changer may be the full FDA approval. We'll see. So we're averaging a little over 820,000 shots in arms per day. It certainly isn't where we were at the peak of our vaccine administration back in April, but it certainly is an improvement compared to where we were in June. Back in June, we were averaging a little over 500,000 shots per day. We have increased that to over 800,000. So on average, 300,000 more people per day are getting the vaccine. And as I mentioned just now, with full FDA approval, we're hoping that that number will increase so that we can reach that threshold much earlier than next March. So we'll see what ends up happening. In terms of the top states and vaccination rates, you already know the Northeast is leading the charge. Vermont, Massachusetts, Connecticut, Rhode Island, Jersey is representing the Northeast. Go Jersey. The states that are at the bottom where there is room for improvement, that's what we'll call it, room for improvement. Alabama is the lowest vaccinated state in the union, followed by Mississippi, West Virginia. Wyoming is representing the Midwest when it comes to low vaccine rates, and then the U.S. Virgin Islands. So for those of you who plan on getting your Caribbean groove back, keep their vaccination rates in mind, especially as you travel, in terms of your own vaccination status, masking up, and getting tested when you come back. As it relates to vaccine rates among races, because I think it's important for us to continue to keep an eye on who is getting vaccinated and who is not. 58% of those who are vaccinated are white. 10% of those who are vaccinated are African American, and that number has remained steady since the Kaiser Family Foundation has been reporting it out for the past month. We African Americans make up nearly 13% of the population, but only 10% of those who are vaccinated in this country. The Latinx community has bumped up their vaccination rates. When we were reporting out a couple of weeks ago, they were at 15% of the population being vaccinated. Now they are at 17% of the vaccination population. So clearly in the Latinx population, they are on the increase in terms of getting folks vaccinated. In the Asian population, it has remained steady at 6%. So there's a lot of work to be done. Now, the question is it a matter of access, trust, whatever the issues may be, whatever the case may be, we have to address it, right? We also have to look at the data in terms of reporting out who isn't getting vaccinated. There's a lot of conversation around African Americans not being vaccinated, but particularly in the South and in the Midwest, we have to be honest about other individuals who aren't getting vaccinated. When the Kaiser Family Foundation reported out data just recently, Republicans, not to say that all Republicans are white, because I have family members who are Republican, God bless them, but Republicans as a whole represent the largest population of people who are not getting vaccinated. They are also the population that has identified themselves as not being open to getting vaccinated. The second largest population of individuals who are not vaccinated are our 18 to 29-year-old population. And their reasoning for not getting vaccinated is that they just don't see the reason. If they're not at high risk for COVID-19 infection, which they perceive their risk to be low, both because of developmental reasons and because we have done a good but horrible job of communicating to them what their risk is, right? And when we take into consideration what their perceived risk has been with particularly the mRNA vaccines associated with myocarditis, a lot of them are more concerned about the side effects from the vaccine than they are the side effects from the actual infection. But for any young adult who's contemplating getting the vaccine or not, keep in mind that what COVID-19 infections do is worse than what the vaccine could possibly do. So if you're worried about myocarditis, you have a higher risk of myocarditis with the infection than you do with the vaccine. If you are concerned about infertility, there has been no evidence to support impact of fertility with the COVID-19 vaccine. But guess what? There is strong evidence to support impact on fertility when it comes to the COVID-19 infection. We know COVID-19 gets all up in the sperm, decreases sperm count and sperm motility. There's no more impact on fertility than messing with the boys, right? So that's what we do know. If you're 18 to 29, not only does it mess with the boys, it also messes with performance. So keep that in mind, 18 to 29-year-olds, as you're contemplating whether or not you're going to get this vaccine. So perhaps we should have some of that messaging out on TikTok and on Instagram to help people make this decision, all right? So let's talk a little bit about updates. Booster. That has been a topic of conversation for the past week or so. I was out of town and heard about it while out of town. I want to talk a little bit about boosters. How did the CDC come up with this recommendation? Folks contemplated, well, maybe it's because the Delta variant is so ferocious, it's sort of overwhelming the vaccine immune response. In actuality, it's looking at the data as we should. As we've talked about before, all of the vaccine manufacturers are continuously monitoring immune response, month in and month out, looking at how well our bodies are mounting an immune response. So they're looking at in December, following the clinical trials. They're looking in June, then they're continuing to follow. Based on the data collected, they saw a significant decline in antibody response between the 6th and 7th month. So it doesn't mean that when Pfizer reported out they had good immune response at 6 months, it means that the vaccine no longer worked at 6 months. What they were able to determine at 6 months is that you still had a really good response. But then the 7th month showed up, and that's when they were able to see a decline in the antibody response, which then facilitated them earlier than the FDA and the CDC recommending a third shot. Based on what Pfizer already knew from the data they collected, they were pushing out, as you guys can recall, about 1 to 2 weeks before the FDA and the CDC. They were saying in the news media, we need to go on and push this booster. And the CDC and the FDA were like, no, wait a minute. And that's how it's supposed to work. The FDA and the CDC review the data. they make an informed decision, not based on Pfizer and their big pharma position, but truly based on the data that exists. What is going to fuel the need for us to get a booster? And as we talked about on several Facebook Lives before, the issue in terms of determining a booster was, is there a variant that is able to escape the immune response? Not yet with Delta variant, although we do see a decreased immune response. It has not escaped the immune response from the vaccine. Do we see a decline in antibody or immune response in any population? Are seniors, are immunocompromised? The answer was already yes. So the CDC had already recommended a booster for those populations. But now, looking at the general population, they had enough data to say, yes, everyone needs a booster. So the guidelines are for you to receive a booster 8 months after you have received whatever was your last shot, right? So I got my COVID-19 vaccine back in April of 2020, right? So clearly I'm more than 8 months out. I'm open now. I can get a booster dose, right? And then what you want to keep in mind is that we're continuing to collect data. Like someone asked me yesterday, I was giving a talk, and they said, Dr. Hancock, don't you feel like you are a hamster in an experiment because they're still trying to figure all of this stuff out? And, I said to her, I don't feel like a hamster on a wheel because the information that we needed, at least initially, was already there based on the clinical trials. They've done nothing differently than they would do with any other new drug or vaccine rollout, right? So any new thing that comes out, the FDA is still going to collect data. The drug company, whoever creates whatever the new thing is, they're going to continue to collect data to see how people are responding to whatever the new thing is. And so this is the way the system works. But this is probably the first time the general public has a peek behind the curtain, which makes us feel like we are hamsters in an experiment. But that is not the case. So as of September 20th, if you are at least 8 months out from your last COVID-19 vaccine, you are eligible as long as you are in the age group, right? The 12 and older age group, to be able to get a booster shot. So that's the latest and greatest when it comes to getting a booster. Let's talk about FDA approval, all right? That was the big thing happening this past week on Monday. Everyone was most people were very, very excited that Pfizer received full FDA approval. The cynics were like, well, how did that happen so quickly? It isn't that it happened so quickly. It happened in the way that it was supposed to. Over 200 million doses of Pfizer vaccine have been administered in this country alone, and millions of doses, hundreds of millions of doses across the globe have also been administered. Pfizer had to submit I think the report was like 36,000 pages, like a 36,000 page report from their clinical trials all the way through till now. They reported out safety issues, efficacy results, adverse outcomes. All of that data was presented to the FDA. But the FDA didn't just rely on Pfizer's data. They did their own independent review. No matter how much you distrust the government, how much you distrust Big Pharma, the fact that there are two different entities reviewing all of this data, that there have been over 200 million administrations of this vaccine, that allows me, if I received the Pfizer vaccine previously, it would give me such peace in knowing that 200 million doses had been given, and based on the data that was available, we can now know what are the safety issues, what are the adverse outcomes, the most common ones, because now comes the drug insert, right? That laundry list that you pull out when you get ready to take a medication. We will have what's called a vaccine information sheet, a sheet that I give, any vaccine that I give to anybody, I give them a vaccine information sheet issued out by the CDC that discusses what the vaccine is, what it's made of, what the side effects may be, and what the adverse outcomes may be, the most common ones. 200 million doses we have a very good understanding over the period of more than a year, right? We have a clear understanding of where we are in terms of this Pfizer vaccine. And so for those of you who may have been concerned, the fact that the FDA felt confident enough with the data presented by Pfizer and the independent information that they were able to review on their own to make this decision makes me very comfortable in further recommending this vaccine. Now, what is the impact going to be? The first impact is that it will hopefully encourage more people to get vaccinated. There were at close to 30% of individuals surveyed by the Kaiser Family Foundation that said, if the FDA approves it, then I will strongly consider getting it. Well, guess what? The FDA approved it. We're anticipating that around 6 million more people may get vaccinated based on the fact that the FDA has now approved the Pfizer vaccine. And I want to be clear, they approved it for 16 and up. Full FDA approval for 12 to 15 has not yet been done. It is still under emergency use authorization. So this full approval is only for 16 and up, specifically for the Pfizer vaccine. What this will also do is open the door for more mandates, right? Employers, organizations, institutions will now be able, within their legal right, to mandate vaccination of their employees, contracted workers, etc., right? If you're going to a concert, there may be the obligation to show your COVID-19 vaccine status because at least for the Pfizer vaccine, it is now FDA approved. So that decreases the legal fight that employees initially felt that they had when it was under emergency use authorization. The other part of this that we have to consider is health insurance companies. Will those who are unvaccinated be stuck with the bill if they get sick from COVID and end up in the hospital? That's a real question. It is being contemplated by insurance companies as we speak. And healthcare organizations. We heard the hullabaloo coming out of Dallas where a memo was somehow shared that they were considering having to decide if there's one ICU bed left, who do we give it to, the vaccinated person or the unvaccinated person? And of course, there was so much uproar over it. One, they were like, we know better than to publicly make this statement. Oops, our bad for even putting it on a memo. But of course, we wouldn't consider that. It was just something we were thinking about. It was an exercise, right? But somebody seriously considered that. That's why it showed up on a memo. And then the other reason why this is so important is that instead of the Pfizer vaccine in terms of access being limited to certain organizations, big chain pharmacies, hospitals, and healthcare organizations, it will be physicians like myself that can go to Pfizer directly and order the shots and make them available to our patients. So it will definitely improve access for us in the health field to make the vaccines more accessible to the general population. Now, the caveat, the concern is that with the Pfizer vaccine now being available to be ordered, that healthcare providers can use it what we call off-label, meaning that if an 11-year-old shows up and mom and dad are like, can you go on and just give her the shot? A doctor could use it off-label, but the American Academy of Pediatrics tried to get ahead of that and say, please don't do that. We still do not have sufficient data to know what the appropriate dosing should be for children under 12. So I say that to say, please do not approach your pediatrician or other healthcare professional trying to get your under 12-year-old child vaccinated until there is emergency use authorization for under 12. All right. So I put that out there for that reason. The other bit of good news in terms of full FDA approval is that Moderna just today, fresh hot off the presses, Moderna just submitted their paperwork for full FDA approval for their vaccine for those 18 and older. So we will see, will it take as long for Moderna as it did for Pfizer? It took Pfizer a while to get their information reviewed and approved. I would imagine with Moderna, it will be no different. They will likely have to submit this thousands of pages, and the FDA will likely do their own review as well. But it'll be happening likely within the next couple of months. Let me make sure I don't miss anything so that we can jump into this conversation about children, right? So I had the opportunity today, actually, of talking with the amazing news reporter Tashani Whitlow on the Black News Channel, specifically about children and COVID, particularly given how much more we are seeing children impacted by COVID because of the Delta variant. Not in terms of severity of illness, but in terms of the number of children infected. So let's talk numbers first. So this is going to be my new part of what we do together on Facebook Live, is specifically dedicating time to our little ones on a weekly basis. So for our children, prior to last week, we were averaging around 80,000 cases, right, of COVID-19 within our pediatric population over the span of a week. Just last week, that went from 80,000 to 150,000. From 80-something thousand to 150,000 new cases. A four-fold increase in terms of the number of children who are infected with COVID-19 over this past period of time. When you look at the total percentage of children and how much COVID is represented in the pediatric population, children previously, throughout the pandemic, made up just shy of 15% of all COVID-19 cases. In this past week, over the period of August 19th, because I use that as my date of reference, given that it was my birthday, almost 23% of COVID-19 cases in the pediatric population. It coincides clearly with our children going back to school. And I know it's scary for a lot of individuals as we're contemplating whether or not we send our little ones back to school. And as I've talked about before, the risk of transmission among children is really based on what's happening in our community and what's happening among the adults. If we do not get the adult numbers together, we will continue to see these rapid rises in terms of our cases. With the increase in the number of children infected with COVID, we're also seeing record numbers of children hospitalized from COVID-19. The number of children hospitalized due to COVID-19, a record was broken just this past Saturday. 1,900 children were hospitalized in one day on Saturday due to COVID-19, the highest number of children hospitalized in the history of the pandemic. But you add that with some of the common stuff that we deal with in pediatrics. So what we're seeing in the DMV is a combination of COVID and something called respiratory syncytial virus, RSV. A lot of you likely have heard of it if you've had kids. It's one of the most common, if not the most common cause of upper respiratory infections in the pediatric population, especially under the age of 5. And so when you combine RSV with COVID, that is what's driving a number of these hospitalizations, because with RSV, children are at increased risk of what we call reactive airway disease, early development of wheezing. So you combine some wheezing with COVID, that is going to likely put your little one in the hospital. The risk factors for hospitalization are the same as for adults. Children dealing with obesity, children dealing with type 2 diabetes, children dealing with high blood pressure, children dealing with asthma are going to increase their risk of hospitalizations. The blessing is that in total, we have not seen more severe symptoms associated with COVID. Again, children being severely ill from COVID is still rare. Complications from COVID, particularly the multisystem inflammatory syndrome, we're only seeing a slight bump in terms of the number of children dealing with it, only because the number of children infected with COVID has increased. And as you guys can imagine, as we've talked about before in terms of disparities, Black and brown children continue to be disproportionately impacted by COVID-19 infections, hospitalizations, complications, and death. It has a lot to do with what their parents do for a living. As we've talked about before, a lot more Black and brown communities are on the front lines in terms of working. But we also have to be honest in terms of vaccination rates. When in places like DC, where less than 4% of those who are vaccinated are African American in the District of Columbia, then that puts our children at risk. So when people start talking about, well, I'm concerned about my kids going to school and being exposed to COVID, my first recommendation among my families is to get vaccinated so that you protect your little one and you don't bring it home. So that's what we're talking about in terms of numbers. The biggest protection, particularly for children under the age of 12, since they cannot yet get vaccinated, is to mask. Don't let any body tell you that masks are bad for kids, that it impairs their socialization, it messes with their psyche, they're not going to develop, they're not going to be able to learn. None of that is true. This bad boy right here is going to facilitate your little one being able to stay in school. Even if the governor has passed a law to ban mask mandates, the school can't require a mask, but they can't tell you your baby cannot wear one. Put a mask on your baby, on your grandbaby, your niece, your nephew, your cousin. Tell your neighbor's kids, get themselves a mask. I have masks for my little one. She's going to have at least 2 to 3 masks as backups in her backpack. I didn't hoard them, I promise you, but I have a good little 20 plus supply of N95s for her so that we can get through at least this first semester of school, all right? Mask, mask, mask. The federal government can supersede these laws pushed out by the state governments. They have not done it yet. Instead, school boards have had to take their officials, their government leaders to court to challenge this lack of mask mandate, because we know that masking protects lives. As we talked about a couple of weeks ago, 3 teachers in Florida lost their lives like within 1 day based on the fact that there isn't a mask mandate. We need to make sure at minimum, if we're not requiring vaccination, at minimum, we need to be masking up. And that certainly is the biggest concern for families, sending our little ones back to school. What can we do to protect them? The first thing to do is to make sure that they're masked up. If they're old enough to get vaccinated, then clearly make that choice if you are comfortable. Third is to find out what the vaccination rates are for the schools, administration, staffing, and teachers, and to find out what the ventilation processes are in the school. Have they addressed their HVAC flow? Are they able to keep windows open? Are they teaching the students in cohorted groups? Are they doing pool testing for their teachers? The Los Angeles Unified School District, which several of my sorority sisters represent well. Shout out to Cherie and Dr. Rapino. You guys are handling your business. LAUSD has created a very strong, strict guideline in terms of how they're managing through this pandemic. They are requiring vaccination for their teachers. They have mitigation measures in place by cohorting their students so that there is not a lot of student interaction. They are requiring pool testing monthly to assess and screen and survey what's going on from a testing standpoint. Masks are required, even if families are coming in, staff, visitors, no matter who it is, they are making sure everyone is masked up. So they are setting an excellent example. It's costing a good amount of money. I'm proud. Kudos to LAUSD. I'm a former LAUSD teacher myself. The fact that they committed funds to protecting children, staff, administration, and teachers. It's not a perfect system, but it certainly sets an excellent example. So that's what we have to do. I created a handout. I completely forgot to share it. I created it for a community event that I did a couple of weeks ago with Step Africa, but I will push that handout out so that you guys know not just what to talk about with the school, but what happens if your little one gets the sniffles. What should you do? What happens if your little one tests positive for COVID? What you should do. All of that is included in the handout that I will share with you guys on a separate post. All right. I want to make sure I don't miss anything before I go on to vaccine. Let's see, children's. Absolutely. It's amazing to me. Let me make sure I don't miss it. Yeah. So when I talk to the folks over at children's, what's interesting is they're seeing more of our standard respiratory infections. They have not yet been inundated with COVID-19 patients independently, but there is a collective. And with Children's Hospital, I serve on the community advisory board, and they have some very strict guidelines themselves in terms of how they're navigating folks through. So what you will find as you're going through any of these clinical spaces is that there will be some specific guidelines that each of us have to follow. And the thing is to follow them, right? Hold on, I feel a tickle. Let me get a sip. It's amazing to me that with the guidelines set forth, and I'm going to say this for school, but it's for any space, right? With guidelines set forth to protect us, right? Whether it be preparing for a concert, right? If you want to go out, get your life back together, be able to enjoy good music. But the requirement is either proof of vaccination or going to go get a test, especially when there's still free testing available in whatever area you live in. Now, mind you, it might be a little hard to find, but it's as easy as going on the website. Here in Maryland, there are sites to still get free testing. In places like Philly, there are places to get free testing. There are mobile units going all around areas to do free testing. Go get tested. Like, why not protect yourself, the people that are around you, the little ones you may want to bring with you, right? Get yourself tested so that everything can go back to normal, so that we can enjoy ourselves, enjoy being out and about, enjoy good music, right? We have to think about the impact that has, our choices, right? Like, don't be lazy about going back to whatever our new normal is. Do what you need to do to make sure your babies are protected. If you don't want to get vaccinated, get yourself tested on a routine basis, right? I test myself, even though I'm vaccinated, because I'm interacting with people so often. I'm routinely testing myself so that I don't pose a risk to my daughter or my mother or anyone else in my circle. It does not take a lot of effort for us to be able to protect each other and to protect our babies, especially as they get ready to go back into school. So let's talk a little bit about our babies and vaccines. So Pfizer is preparing to submit their trial data for their 5 to 11-year-old vaccine. It's anticipated that it won't be until October that this information is reviewed by the FDA. A decision will likely not take place until November, so well into the first half of the school year. In terms of updated emergency use authorization, if we were to get that from the FDA for this Pfizer vaccine, and hopefully for Moderna as well, that's an additional 28 million people in the country, little ones, of course, who would be able to get this vaccine, adding to the rates of herd immunity, pushing us closer to that 85 to 90% threshold. So fingers crossed that we get there. In terms of full FDA approval, for the 12 to 15-year-old population, they're anticipating that may not happen until the end of 2021 because they're continuing to explore the concerns about myocarditis. That's what's taking a little bit longer. The reason why the 5 to 11-year-old emergency use authorization is taking a little bit longer is they're still trying to figure out, one, the appropriate dose, right? So the question is, do our 5 to 11-year-olds need the same full dose that the 12 to 15-year-olds needed? Or can we give them half dose? And if we do half dose, do we see the same immune response over 6 months, 12 months, etc.? All of those are important questions to ask. Not only that, the more important question is safety. We have to make sure that for our babies, for us as parents, to give our little ones this vaccine, we have to know, based on data, that there aren't any adverse outcomes that we aren't going to discover until more children end up being exposed to the vaccine, which is why the FDA mandated that both Pfizer and Moderna expand the number of children in each of their 5 to 11-year-old trials in order for us to have a more robust study so that they can be very confident in the data that comes out. That's why there has been the delay, and that's why it's not anticipated that we will have that information available until the late fall, early winter of 2021. But I remain hopeful that we will get there, and that prayerfully, as we go into 2022, anyone between the ages of 5 through will be able to get the vaccine, and then likely shortly thereafter, we will be able to have our 6-month to 4-year-old age population getting it based on the data and the need for them to get vaccinated. So those are our updates. I want to make sure I don't keep you over too long. We're at 10:05. The last thing that I wanted to share before we sign off is, as you guys likely saw in my social media earlier today, we have a relaunch of the Ask Dr. Yola website, where it encompasses hopefully all the goodness that I bring to the table, not only in terms of clinical care, but a lot of the educational information that I like to make available to my patients. I figure if my patients have access to it, why not everybody else? So we're pushing out wellness guides that speak about various health topics. It's categorized with nutrition, chronic disease management, any pediatric related issues that you may want to focus in on, any of the hot button health topics like COVID-19, being able to address some of those questions and giving you information from a trusted source. I want you guys to check the website out. Let me know what you think. I want your honest opinion as we go through finalizing all of the details, because I want it to be a place where people feel comfortable and confident in getting their health questions asked. All right. Thank you guys so much for hanging out with me every Wednesday, or at least almost every Wednesday that we come together. I will definitely be continuing to keep you updated. And when there are any late breaking stories, pieces of information that are critical that I want you guys to have like right at the forefront, I will make sure to push those out to you guys as well. Until next week, thank you guys. Take care of yourselves. Take care of each other. Love you. Dr. Yola out.